Hey everyone, it's Nurse Dani coming to you live on Facebook today, and I have a very special guest, Jesse Ellis. He's a licensed clinical social worker here at Utah Valley Hospital. That's where we're coming live from. And he's done so much work here in the name of postpartum depression. He's been a key player in all the things we're going to talk about today, all the new screening tools that we have to help women who are struggling with postpartum depression or who might struggle with it. So hopefully we share some things today that will be helpful to you. And if during the live stream you have specific questions, you can leave a few comments below and we'll get to as many of them at the end as we can. But Jesse, start with introducing yourself to everyone.
Sure. Thank you, Dani. I'm very happy to be here. This is an exciting opportunity for me. I have been helping the hospital develop new services for maternal emotional wellness. Because of my mental health background and because of some personal experiences. I have a degree in mental health treatment. I'm a clinical social worker, and I've been working in a variety of settings here in the hospital for the past 10 years. So early on in my career, I was in the emergency department as a crisis worker, and then I've moved more into managing what we do on the general medical units and our women's service line. Yeah.
You mentioned that this is near and dear to your heart as well. Do you have personal experience with this, family members who have gone through or had postpartum depression?
Yeah, definitely. And I should say that my wife is okay with me talking about these things. My wife's a nurse. We have 5 kids. We, up until her first experience with postpartum anxiety, didn't know much about all of this and really didn't have these types of struggles in either of our lives. About 9 years ago, she gave birth to our first son. The labor was hard. The pregnancy was really hard. After Liam came, there was a lot of excitement, of course. Unbeknownst to me, about a week into all of this, she stopped eating and stopped sleeping. And it was about 2 weeks into, Liam's life that she was having a mental health crisis. So she scheduled an appointment to see her obstetric provider. I took her there. They had conversation in a room that I wasn't in. And he came out and said, "I need you to take her over to the emergency department." And at the time, I was actually working in the emergency department as a crisis worker. So, I was sensitive to what was going on when we came over here. Kelby had been a nurse here in the ER, but she was just in the waiting room, incredibly tearful and overwhelmed. So a handful of practitioners wrapped their arms around us, helped us put together a productive plan to help her work through all of this. That was a 6 to 9 month journey. And then
that's important to note. It's not a quick fix. It doesn't always change overnight.
Right.
It takes some time, but there's hope that that's not how you always have to feel after.
Definitely. I think afterward we sat here and tried to make sense of all of it. What caused this? Is this my chemistry, my biology? Was this me adjusting to parenthood? Was it related at all to a traumatic delivery? And so we went into our second child, playing it by ear, just saying, let's see how this goes. Well, it happened again. So Aiden came along and, 2 weeks post-delivery, she started having pretty severe anxiety. So she'd have 2 or 3 panic attacks a day, and she just couldn't sleep. So we'd be at home, and I had a sense of when she was starting to have a panic attack because she'd be pacing. She wouldn't want to be alone. She would come and want to be very close to me. This is a woman that's always been very independent and type A and organized and capable, and suddenly was feeling very incapable and in despair. You could just see the despair in her eyes. So
heartbreaking for you.
Oh,
too.
yeah. No, just so sad, especially after everything that women go through to make a baby. To have to suffer through, all of the nauseated feelings and throwing up half the time, and having a baby inside of you sitting on your bladder and all these uncomfortable things, right? So anyways, just not fair. So it was then that we went back to what we did with Liam. We went back on kind of that treatment regimen, and things cleared up. We then had a third. We had a girl. And we just were better prepared for that to occur. So we were more proactive prior to Penny's delivery. Kelby started SSRI, a medication prior to delivery, which made the symptoms much less after Penny was born. And then we had a fourth pregnancy, which was twins. And that was probably the worst of the 4 pregnancies. And our twins are 2. So, we've seen it firsthand. We're very aware of how this has affected our community. We're very aware of the personal struggle, of the gaps. We're aware of those who've really suffered and some that have ended their life. I had a wife who, for all intents and purposes, without proper support, could have been very critical and could have just left. So we know it's a real issue. It's a public health issue. We know that it sometimes becomes so troubling that you don't feel like you have a lot of control over it. And I guess, we partner with all of those in the community that are trying to build awareness and help families, moms, partners, make sense of all of this.
There's no better person to be talking to about this than you. Thank you so much for being willing to share all of that, because you have not only the professional background, but the personal background as well. And that means a lot, I'm sure, to someone who's struggling with it too. You guys have been through it. So you hit on a lot of important things. Let's start with what causes postpartum depression.
So there's a variety of theories. There's multiple causes. It's possible that a lot of this is biological. So I try not to use words like hormones. I try not to use words like disorder. I just think they're really strong clinical terms that make people feel like they aren't allowed to talk about it. But think about like your progesterone, your estrogen, what's happening with your thyroid. There's a number of things that are happening physiologically within a woman's body after giving birth or prior to giving birth, where the physiology is just changing. So this affects serotonin levels in your brain, and that can affect your mood. So, biology, I think, is a big player. For Kelby, specifically, I think biology was a big player. And after all of the kids were here, we, in conversation with the obstetric providers and some of the psychiatric staff that helped us, we think there was a correlation with her losing a lot of blood. So with our first and with the twins, she hemorrhaged and she had to have blood transfusions. And even though you have blood transfusions, I'm not a doctor, but I know that it takes a while for your body to rebuild iron and red blood cells and things like that. And
not to mention the fact that that's traumatic too, and that's going to have an effect on a woman's mental well-being too.
Right, and for Kelby, in those pregnancies, that was where her body just really wrestled to kind of overcome this mood struggle that was so hard for her to feel like she had control with. There's social determinants. If you have a history of depression or anxiety, that can certainly be exacerbated.
Before or during pregnancy.
Yep. Those conditions could put you at risk, but I don't always see that. In practice, we see some people who may have had struggles with depression, but then how their hormones interacted with their body during pregnancy and post-delivery, they'll sometimes say, I'm the happiest I've ever been. Other social determinants that play into this is just everything that comes along with making a child and then having that person be solely dependent on you. Sleep deprivation, losing your independence, the financial stress of all of it, the inability to just interact socially how you used to. So all of your time, the interpersonal struggle that comes along with, I thought I was supposed to love this. It's really hard. It's a lot harder than I thought.
And no one talks about that. So if you start experiencing that adds to feelings of guilt and depression and anxiety, because you're like, everyone else loves this. What's wrong with me? Right.
The image out there is, I'm supposed to love motherhood. Mm-hmm. And this is a role that I was meant to fulfill. And if I don't like it, then that means I'm a bad person. But if you look at social research, that's not what social research suggests. I think we can still say that we love our kids, but we can admit that it's a hard job.
Yeah, my daughter, she's 10 and just, it's probably been a couple months now, but one day we were in the kitchen and just out of the blue, she said, is being a mom fun? And I was like, oh, that's not really the word I would use. And I said, being a mom takes a lot. It's a lot of work, but anything that you work hard at brings you a lot of joy.
Good reply, yeah.
And she was like, okay, and went on her way. But but I definitely couldn't use the word fun.
Right.
Because it is hard.
It is. It's a big job. You have to look at, especially in the initial stages of it, what you're doing to prepare your body to just manage all of this. So if you're not sleeping productively, you're not getting long, at least 2 stretches of 3 to 4 hours of sleep at a time, you're not giving your body the opportunity to really rest and rejuvenate.
And a lot of moms bring the baby home from the hospital and think that life needs to go back to how it was before, and the house needs to be perfectly clean, and you need to be able to stay up on the dishes and the laundry, and people are going to come over and see you, so you better clean the house. And so you don't rest when your baby takes a nap either. You just try to keep up that pace, and it's impossible.
Right. Somebody may come and we may take a picture that might end up on Facebook.
Yeah.
And I've got to have the right ambiance for it.
Yeah, right.
Yeah, it's not a good equation.
No.
I mean, if you think of the social equation in general, we're introducing life at a really complicated stage of life anyway. Many of our families are at critical points with their careers, with their schooling. Many people have to attend to full-time jobs in addition to full-time studies. And so it's hard when you introduce something that is now a secondary full-time job. For each child that we introduce to the equation, you're adding 30 to 50 hours of work per week.
So add that up, there's not much left for parents.
for yourself, for the relationship. There's a lot to parenting that's quite lovely and eye-opening and helps us mature and grow and develop, and it helps us experience a broader range of emotions. There's a lot of beautiful things to parenthood. But I think a lot of what's underneath some of the social determinants of emotional wellness difficulties are some of those thought patterns that we have and the expectations that we carry about how we're expected to be in all of this.
Expectations, that is so key. And when we're talking about risk factors, no one ever lists expectations or how high of expectations you have of yourself or others, but that's a huge part of it. So in addition to a history of depression or anxiety, social determinants, like you were saying, I mean, I can't even count the number of patients that I had on labor and delivery over 11 years that said, we're delivering our baby and we're moving next week because my husband just got a new job.
Right.
And I always took time to talk with them about postpartum depression because I wanted them to know that this life change in and of itself puts you at risk for depression. And you just had a baby. So please watch yourself. These are the things that you should watch for. This is what you should do if you start experiencing these things. So in addition to those kinds of changes, situations, is there anything else that puts someone at risk?
So I think if you struggle with other health conditions, I think if you don't have a great network of caregivers, if you're trying to tackle parenting as a single parent,
Definitely.
I think if you're in a culture, community where you're perhaps a minority, say that you're here studying, but you're from another country, you don't speak the native language very well, you feel, these are very vulnerable times of your life and you feel very far from your family. Those can be difficult things to work through. If there was trauma associated with the delivery, that can be a variable.
And I've talked to one of the saddest things, actually, it's stayed with me. It was one of the first questions I ever got asked on Intermountain Moms. She said, I have a 5-month-old and I'm struggling with postpartum depression related to a traumatic birth experience. And so I asked her if she would be willing to share some of the details. Maybe, I wasn't her doctor, but I could say, generally speaking, like, these things that you went through are typical. You need to talk with your doctor. Because I think that the thing that really stayed with me was that she described a perfectly normal first-time mom experience. She told me she had to labor for 20 hours. She had to push for 2.5 hours. That was traumatic for her because she didn't know what to expect. And so when people don't know what to expect, even the norm can be traumatic.
Right. Well, and it's all relative.
Exactly.
I think so much of what we do in terms of our interactions with healthcare, and for a lot of us, we haven't had traumatic medical experiences. My memory of going to the hospital for our first delivery was, okay, we're just going in for this root canal. It's scheduled, it's on the calendar, everybody does it. I just wasn't prepared for what that was actually going to be. And I don't know what the general perception is, but it is, it's what matters to me as a mental health care provider is what your perception and what your experience is.
No matter what the norm is.
Yeah. So, what means more is how you're interpreting that and what meaning you're assigning to that. Yeah.
So what are the symptoms of postpartum depression? And before we get into that, let's actually talk about postpartum blues, because it's normal I hate using that word, but it's typical for women to experience a little bit of depression, anxiety, to have some mood swings after having a baby. So let's talk a little bit more about that. What someone set the expectation, set the stage for what you might experience, and then talk about how that differs from postpartum depression. When should you be concerned about it?
Maybe it's good to think about the postpartum blues as you're giving your body 2 or 3 weeks to readjust.
I like that.
And you're going to experience a lot of the same symptoms that are very similar to postpartum depression. So lower energy, maybe you're slightly more on edge. We say irritable, but don't have patience for your husband, your partner, the kids. You're tired, low energy. You might be struggling with just feeling very overwhelmed. And kind of having to motivate yourself to get up and stay connected and attend to the baby and put on a smile, things like that. I think that's pretty common. But if what that is persists and increases past 2 or 3 weeks, it's very likely that you're experiencing postpartum depression, postpartum anxiety. We know that 1 in every 7 moms will have something.
So line up everyone you've ever known that's had a baby, and chances are a lot more of them have struggled with it than you might ever think.
Definitely. We are the baby birthing capital of the country. And that was what was shocking to us when this hit for the first time. You would think, and not to be negative about anything, but you would think that where we deliver so many babies in Utah County, that we would understand how to manage and support moms in a better way. Yeah. So, but to get back to symptoms, so with postpartum depression, depression, look at mood disruption as being something on a spectrum. And you're on the sadder end over here, which is depression. You're on the nervous end over here, which is anxiety. And when we talk about this, it's always in the context of postpartum depression. But the reality is there's a whole variety of mental health conditions that can manifest during pregnancy and after pregnancy. But we do know that postpartum depression is the most prevalent of all of those types of conditions. So if moms are going to have something, so if 1 in every 7 moms is going to have something, on average, 10 to 22% of those moms are going to have postpartum depression.
And the other mood disorders include?
So you would have something on the anxious end, so it could be postpartum anxiety. You could have bipolar. You could have PTSD or OCD, obsessive compulsive disorder.
One of my friends told me that she felt like she had this mama bear instinct in her as soon as her baby was born, and so she didn't recognize it as being something, like she didn't recognize it as a red flag, but she would camp out over her baby all night to make sure that they were still breathing and not sleep. And once she realized that that wasn't normal, and she's like, I need to get help for that. Plus she's not sleeping, and that's just going to compound the problem. Or I had another friend who was so worried about her baby getting sick, she wouldn't leave the house, and again, she just thought she had this intense mama bear attitude that came with becoming a mom for the first time. And so, to give a few examples of what that might look like is helpful for people to maybe recognize it in themselves.
Definitely. And I try really hard not to use a lot of clinical terms because I don't know if that always resonates or makes sense to people. I mean, if you tend to be more nervous about things, you have more, we call it hypervigilance, or there just is a greater sense of surveillance on the event and concern for the baby's well-being. Something that starts to become very obsessive for some moms who have obsessive compulsive symptoms is that they're worried that their baby might stop breathing. But other repetitious patterns that they might do to provide some comfort that alleviates the stress of what the environment is, like not going out, or when you go out, you have a particular set of rituals that you do to sanitize things. And if somebody disrupts that, it causes a bit of anxiety for you. It causes you to kind of feel out of control a little bit. OCD is less common. I think what moms might want to know is, what I say is most important is if you just feel like something's wrong. Yes,
you're not feeling like yourself.
Exactly. Let's try to understand that better and let's get underneath it. Because the problem is, like any condition that you don't treat, it just gets worse. So if I'm dealing with postpartum blues that aren't going away, that are turning into more emotional disturbances, more depression, more hopelessness, more social isolation, less motivation. Maybe I'm sleeping a lot or not sleeping at all. Maybe I'm losing my appetite and not even eating. Maybe I feel like I'm eating a lot, and there's just a lot of interpersonal struggle, a lot of shame, a lot of guilt. If we're not attending to that then can evolve into more chronic conditions. Or if it goes to the other end of the spectrum where there's a lot of anxiety, if you take a mom who for 2 weeks doesn't get productive sleep, it's exactly what happened with my wife. She was dealing with an acute psychiatric crisis because she didn't sleep or eat for 2 weeks, and you will lose your mind.
Yes.
That'll cause you to start having mania. When anxiety goes off the charts, you start to have mania, which then translates into these psychotic symptoms. And that's also a condition that can happen, postpartum psychosis, but it's very, it's less common. It's less common. And things to be aware of in all of this is what's happening with just all this conflict in your body and the energy that's in your body, the way that it translates through your mind is it doesn't always send you positive thoughts. So if you're struggling, you're exhausted, you don't feel like you can do this, you don't see the light at the end of the tunnel, all of this feels so overwhelming, that can start to turn into thoughts or feelings of, it just would be better not to do this at all, which then turns into, I don't want to be here, which then may turn into thoughts of hurting yourself or running away or hurting your child. And And those thoughts become really alarming to moms. Like, it's really hard to get moms to tell us that
they don't want to admit that they even thought that.
Right. Yeah, like, you're the last person who'd want to hurt your baby or hurt yourself. But those thoughts come to you when your body's, like, that's just a sign that your body's experiencing a really significant psychological distress.
So instead of internalizing it and thinking that's you and letting it scare you, think, I need help.
Right, this is just a sign.
This is not me, I need help.
Yeah, this is the equivalent that you've got, the flu that turned into pneumonia, right?
Oh, I love that analogy.
Yep. Yeah. And we should treat it in a very similar way.
So let's talk about treatment. And if I'm struggling with these thoughts or feelings, what should I do? Let's start there.
Yeah. So if you have thoughts or feelings that are really disruptive to you and concerning, and those thoughts are, I want to hurt myself, I don't feel safe around the baby, I don't feel safe around myself, I need to be with somebody, and you can't leverage that type of support in your environment, please, by all means, come to the emergency department or talk to your obstetric provider. If what you're struggling with is thoughts of suicide, you will be referred over to the emergency department, most likely, where we've got a team of mental health care providers where, we put together a plan. We talk about what's going on. That might include advanced psychiatric treatment, or it may just involve putting together a plan of how to take care of this issue outside of the emergency department. Linking you to your various providers and maybe getting you to connect it to some mental health services.
And if you were linked to mental health services, what can someone expect? Medication, therapy, both?
I've been doing this a bit. I know that we have very personal experiences, but I, in practice, just think for most people, the best form of therapy is a combination of medication and therapy. I will say that I believe the therapy that should be done is a specialty. So this becomes kind of difficult, right? So if somebody comes to me with Regions Blue Cross as their insurance provider, and they don't have $90 to fork out for a therapy session, and they want to leverage their insurance benefit to cover that, I then have to go to their insurance provider and say, so who are the therapists on your panel of providers? And then we look at the 20 therapists that they have to offer. Are any of those therapists specialized or trained in managing these types of difficulties? They might say that they treat depression or anxiety, and I don't want to give the impression that the mental health community doesn't have good intentions or they're not willing. I don't know if we've fully adopted the fact that this really requires a lot of specialized experience and specialized understanding. Because what happened in our situation, for example, is, well, first of all, from the obstetric provider, Kelby was given an antipsychotic, which probably
that name
wasn't.
Alone scares people
Definitely,
too, right?
Definitely.
They're like, I'm psychotic.
Well, Kelby,
and that can scare them too.
Kelby told the doctor that she wanted to leave, and she was having a lot of conflicts with breastfeeding Liam, and just had a lot of anxiety around all of that. And she said that she just wished she didn't have her breasts. And it was taken as, and I'm sure the elevated anxiety, I'm sure she just kind of gave the impression that she was starting to lose her mind. And then from the emergency department, she was given something for the anxiety. What Kelby and I did rather quickly was, when I found out that she wasn't sleeping or eating, the first steps were, how do we get you eating again? And how do we get you sleeping again? That wasn't easy. It meant I was in graduate school. It meant that she took an Ambien at 8 o'clock at night, and she slept for as long as she could. And I was on tab for feeding Liam. But she needed to recalibrate. She needed to reset her body. If we would have admitted her up to the behavioral health unit, we would have done something very similar. And then she had no appetite whatsoever. Nothing sounded, pleasing. Nothing was attractive. We went to Costco. We bought a bunch of Boosts, and we put it on a schedule where we'd sit down, and she just
had to drink it.
She just had to drink it. Mm-hmm. Yep. And, after a week, things started to turn around. She was given by the obstetric provider 25 milligrams of Zoloft. This is a mood stabilizer. But the SSRIs, the mood stabilizers, generally take a couple of weeks to reach their therapeutic value. So what becomes tricky when you go, I'm not saying don't go to your obstetric provider, but if you're having symptoms that are fairly acute, which that was the case with Kelby, the best recommendation is to work with somebody who's a psychiatrist, like a psychiatrist or psych APRN. And we had a sense of that because of what we do, and we were fortunate to quickly get into services because that's a service line that isn't easy to access. There's usually 2 to 3 week or 2 to 3 month waiting periods. But we've actually changed that here in Utah County.
What are some other things that are being done here in Utah County? I think this is exciting to talk about.
Yeah. So we're screening moms 100% of the time before they leave the mother-baby unit. So moms can expect that somebody's going to come in and talk to you about that. It starts with your nurse. And then if you have concerns, they're going to ask for one of us, one of the mental health care providers, to come in and have some conversation about things.
And things can start, you may have felt fine at the hospital, but then a few days, weeks, months down the road at home, like we talked about, you're not feeling yourself. Then you reach out.
We send you home with the same screening tool that we give you here in the hospital, and we invite you to take 2 to 3 weeks out. Because for most people, that's when it matters. That's when it's kind of like, well, I'm having difficulty, but I don't know if this is just the baby blues and I need to kind of push through it, or this might be something stronger than that. And the tool's just out there. It's something that's readily available on the internet.
What is it called?
It's the Edinburgh Postnatal Depression Scale, the EPDS scale. If you Google it, it's free to the public. You can find a PDF. Moms can look at that and go through the questions, and they can kind of score it and say, I'm not as good as I thought I was.
And you should be honest when you take that.
Definitely,
yeah.
Definitely. One benefit that I think I had in all of this was Kelby. Once we kind of got past the reality that we were struggling, she owned it. She didn't hide it. She was okay talking about it. We threw the stigma out the window.
And how many people has that helped because you guys have been willing to speak out?
Yeah, I mean, it's just one of these funny things, right? Where it's like, if I have cancer, I don't look at it as a personal struggle. Mm-hmm. But if I've got this emotional challenge, for some reason, it's like, it's my burden to bear. And if I talk about it, then people are going to think less of me.
Yeah, we want to break that stigma.
Definitely. So, so kind of back to how to help. So, you're out there, if you had a regular vaginal delivery, your obstetric provider wants to see you in 6 weeks, unless there's complications. So moms should know that they can call and schedule an appointment whenever they need to.
Before that 6 week mark, yeah.
Yeah. We've been talking a lot with pediatricians. Pediatricians actually know I'm usually the first eyes on moms after they leave the hospital. So most pediatricians will ask the mom how she's doing. That's like we know the best way to care for our kids is to make sure the mom's doing well.
I love that approach, and that gives them, sometimes the source of anxiety can be feeding or the fact that the baby's not sleeping, and talking to them about caring for their baby.
Right.
If it's a normal case of anxiety, may help to reduce their anxiety, make them feel better.
Right.
But then help them see red flags if it's different.
Definitely.
Yeah.
We have kind of the self-assessment and referral guide that's given to all of our moms when they discharge. It gives them recommendations of where to go depending on what level of symptoms they're having. It's kind of outlined as high, medium, or low symptoms. That's available. That's something that I think has been shared through different social media outlets and as part of the Utah Maternal Health Collaborative conversation. So the collaborative that's been working with this created a great acronym. I don't know if you guys have talked about this in any of your other streams. Snowball. So if you've got something that's lower acuity, the first step is just self-care. One of the biggest barriers that moms have to overcome is my baby comes first. So I feed the baby before I feed myself. I tend to all the other children before I tend to myself, whatever it is, right? That's great and commendable, but you've got to shift a little bit how you think about that.
Because like you said before, you're going to be a better mother if you take care of yourself.
Yep. Doesn't mean that, baby sits there in the corner and cries for 2 hours
Right.
while you make yourself a gourmet meal. Like, that doesn't happen, right? But if you're going multiple meals without eating productively because you're all caught up in the baby's eating routine, something has to shift. Okay.
Definitely.
So we talk about basic self-care initiatives as part of the early intervention techniques to help moms pull out of this struggle.
Like sleeping, eating.
Sleep.
All those things.
So don't think, I got a total of 8 hours of sleep, I should be fine. If your 8 hours of sleep was an hour and a half here, 3 hours here, what you need to think about is the gold standard is at least 2 3 to 4 hour stretches or 1 4 to 6 hour stretch. So I knew when my wife was in this place, one of the best ways to keep her healthy was to allow her to have a 4 to 6 hour stretch. So we broke the nights in half. So she would go to bed around 7 o'clock. I knew that whatever happened up until like 3 in.the.morning was all on me. Yeah, like all the kids could be awake and we could just have a party together. But it was so important that she fell into that deep sleep, the REM cycle that helps her body rejuvenate. Nutrition.
Everyone out there is wishing that they had a husband as supportive as you. Because what do you do if dad isn't willing to do that?
So it's a great question. And I moderate a lot of these discussions because sometimes that's the way to make this work.
Because it's dad is so caught up in getting his own sleep that he's not willing to give any so that she gets sleep too.
Yeah, husbands just have to know that this isn't. I have husbands periodically or partners periodically. Make the assumption that their spouse is just weak or I know you've got it rough. I've got it rough too. I've got all these stresses and these demands over here. And sometimes you have a lot of women that uphold that, right? Like, I can't put this burden on my husband. I think what you have to look at is however you want to define your roles and your responsibilities is your guys' business. But if you don't do something different, you're going to be dealing with a bigger problem than you want. And that's what I say. So would you rather get your beauty sleep over here, or would you rather have a wife that's really struggling 2 or 3 weeks down the road? Mm-hmm. And if you can't pull it off with your partner, then who are the other people in your life that maybe can help you do that?
But it needs to happen.
Right. Like self-care, this isn't just like if you have time.
It's nice if you could do it.
Right.
Yeah.
The hard thing about it is, if you're in this place where you've got a lot of expectations on yourself and you suddenly add this list of tasks, it can become overwhelming as well. So you want to incorporate this as best you can, but you want to take it seriously. Nutrition's a big deal, a prenatal vitamin.
A lot of people think they can stop taking that after they've delivered, but you should take it while you're breastfeeding and really until after you've had all your babies.
Exactly. And eating foods that are high in protein, avoiding lots of sugars and caffeine. That's a hard thing.
Yeah, that's what you want to turn to.
I know, right? We come to moms where you need 4 to 6 hours of sleep and don't drink any caffeine.
We're going to take away your Diet Coke and don't eat your donuts. Yeah.
They just laugh. They're like, what are you talking about? That's how I'm surviving. Yeah. So omega-3s, omega-3, the fish oils have been approved by the EPA to take during your pregnancy, after pregnancy, and while breastfeeding. But there is evidence that does help stabilize mood. Walking, just some form of exercise. That can be yoga, that can be leisurely bike ride, getting out, getting some fresh air, exercising, getting those endorphins pumping through your body in other ways. Baby breaks, adult time, lots of liquids. I've encouraged some moms to get a 2-liter bottle that's just their specific bottle. They can decorate it however they want. You know how when they come to the mother baby unit, they're given the
we
label
call those
for
nurseties.
Yeah.
Because you should keep it by you and drink it at all times.
I love that. I haven't heard of that.
When thirsty and nursing.
That's great. Yeah. So have your nurse tea available, and then just find ways to laugh. So that acronym is SNOWBALL, and that's available on the website Utah Maternal Health. If people want to see that.
There's a lot of good resources that I'm sure you have. We'll put in the comments below so people can go back and refer to those too.
Yeah, I don't know how broad the reach is here, but people should know that counties have a list of services that are free to the community. So in Utah County, if I call the United Way, and I don't know if people know this, but you can just pick up your phone and push 211 wherever you are in the state, and you'll get linked to a volunteer through the United Way. And every United Way access center has volunteers that work with the Help Me Grow program. So those are volunteers that link families to services where moms might be struggling, or families might be struggling for a number of reasons, right? In Orem, there's a service, the Family Support and Treatment Center. It's free to the public. It provides a nursery that's free to you, that's 24/7.
That is amazing.
So if you just need respite, if your partner's working a lot and you need to go run groceries, but you just can't stomach the fact that you've got to, wrestle with naps in the middle of all of your errands and feedings and things like that, it's a great place to go and just say, I'm good 90% of the time, whatever it is, can you just help me with this? And they're gonna receive you with open arms. They'll let you go do what you need to do, and that's a good place to stop and say, is there somebody I can talk to? And they even offer monthly support groups specific for this. So all of that type of stuff is free, and that's available here in Utah County, but each county through the United Way is going to have a different portfolio of services. And I don't think that it's well known. I don't think they get utilized as much as they should.
Oh, yeah, for sure.
Yeah. On a bigger scale, there's Postpartum International. That's an organization that has a tremendous website with a lot of helpful information. And they have a 24/7 hotline where you can call and talk to somebody if you need help. I think what's great for us is that we do have the ability to connect. So if we're not connecting in person, we can connect online. Moms can go to Facebook and they can search for different groups. My wife's part of this Moms with Multiples group. And a running theme in all of it is what it's like to raise twins, what it's like to, face emotional challenges while raising twins. And she gets a lot of support and validation, and it rejuvenates her, right? So I think if people are living in private with all of this and living in secrecy, they don't have to. And I think that they would be surprised to know that there's a lot of us out there talking about this.
If nothing else, that's a good message to end with, I think,
is
that you're not alone. There's so many resources out there. And really, I can't thank you enough for being with us today, for sharing your personal experience, and your wife's too. We're grateful for that.
Thanks, Dani.
And if you guys have any questions in the future for me, of course, you know where to find me on Facebook. And you can just send me a message at any time. And you can also look forward to our weekly live streams. Thanks, everyone, for joining us, and have a good day.